Hello, I am Professor Dr. Mustafa Gökhan Bilgili. In this video, we will talk about exploring the physical and psychological limits of cosmetic limb lengthening. Cosmetic limb lengthening surgery is a remarkable medical procedure that allows individuals to enhance their aesthetic appearance by increasing the length of their limbs. However, like any surgical intervention, it has inherent physical and psychological limits. Today, we will delve into the interplay of physical and psychological boundaries in the context of cosmetic limb lengthening surgery. Exploring the constraints, challenges, and potential impact on patients' well-being. Firstly, we will talk about physical limits and bone health. One of the primary physical limits of cosmetic limb lengthening is the patient's bone health. For successful limb lengthening, patients must have adequate bone density and overall bone health. Weak or compromised bones may not be able to withstand the surgical stress or support the lengthening process. It is essential to evaluate the patient's bone density and condition, as compromised bone health can limit the extent to which lengthening can be safely achieved. Secondly, we should talk about skeletal maturity. Skeletal maturity is another crucial factor. The procedure is typically performed on individuals who have reached skeletal maturity, as the growth plates in the bones must be closed to ensure the safety and effectiveness of the surgery. Attempting limb lengthening on individuals whose bones are not yet mature can lead to complications and interfere with normal growth. Thirdly, let's talk about soft tissue constraints. Limb lengthening affects not only the bones, but also the surrounding soft tissues, including muscles, ligaments, and tendons. There is a limit to how much lengthening the soft tissues can accommodate without causing excessive tension, pain, and potential complications. Fourth topic is about surgical complications. There is an inherent physical limit to the extent of surgery that can be safely performed. Longer lengthening procedures often carry a higher risk of complications, such as non-union or joint misalignment. Surgeons must strike a balance between the patient desires and the safe limits of the procedure. The last topic about physical limit is about the recovery period. The recovery period following cosmetic limb lengthening surgery is another physical constraint. The healing process takes time and requires patience and commitment from the patient. Lengthening too quickly can lead to complications, and pushing beyond the physical limits can result in pain and discomfort. Another important topic about cosmetic limb lengthening is its psychological limits. Cosmetic limb lengthening surgery may attract individuals with body dysmorphic disorder. It's a mental health condition characterized by an obsessive focus on perceived physical flaws. Patients with body dysmorphic disorder may have unrealistic expectations and may never be satisfied with the results, highlighting the importance of psychological assessments. Psychological limits of cosmetic limb lengthening surgery also involve managing patient expectations. Unrealistic expectations can lead to dissatisfaction and emotional distress. Patients must understand the limitations and potential risks associated with the surgery. In addition, the psychological limits are closely tied to the patient's emotional resilience. Surgery and recovery can be challenging, and the ability to cope with setbacks and temporary limitations is crucial. Patients with lower emotional resilience may struggle more during the process. We should find a balance during limb lengthening. Responsible medical practice strikes a balance between the physical and psychological limits of cosmetic limb lengthening surgery. Surgeons must prioritize the well-being of the patient, ensuring that the surgery aligns with their physical health and they are emotionally prepared for the journey. Ethical considerations in the field of cosmetic surgery involve assessing the motivations of the patient and the potential impact on their psychological well-being. It is essential to address psychological concerns and promote a holistic understanding of the surgery. Another important topic is setting realistic goals for cosmetic limb lengthening surgery. Patients, surgeons, and medical professionals must collectively establish achievable objectives that align with the patient's physical health and emotional readiness. As a conclusion, cosmetic limb lengthening surgery rests at the intersection of physical and psychological limits. The success of the procedure depends on careful consideration of the patient's bone health, soft tissue constraints, and the recovery process. Equally vital is the management of psychological limits, including the impact of body dysmorphic disorder, expectation management, and emotional resilience. Responsible medical practice and ethical considerations guide the process, promoting a realistic goals and ensuring the well-being of the patients. By finding a balance between the physical and psychological aspects of the cosmetic limb lengthening surgery, individuals can embark on their journey with a greater understanding of their limits, expectations, and the potential for transformation. Bye-bye.